It's spinning. It's just okay. I think that give it 2 more sec. Give it. Okay, I think you're ready to go.
Thank you. Good evening, everyone. I just want to start off again by reading the statement that this meeting of the Board of Health is being held electronically with members participating via remote access in compliance with the State of Illinois gubernatorial disaster proclamation. Members of the public who wish to comment as to any item on the published agenda must submit their statement or question in writing to Mike Charlie, Director of Health and Human Services with the Skokie Health Department. And all properly submitted statements or questions will be presented and read during the relevant portion of the meeting. Written comments may also be submitted by email to publiccomments@skokie.org or by mail to the Village Hall. Attention, Mike Charlie, Director of Health and Human Services with the Skokie Health Department at 5127 Oakton Street, Skokie, Illinois, 60077, or via the village's drop box located by the public entry to Village Hall. Again, I am pleased to see those of you who are able to join us. I hope everyone is doing well and in good health. I'd like to officially call this meeting to order. And our first bit of business will be the approval of the agenda and the approval of the minutes. And so since we're working under a consent advisory, I just would like to entertain any objections to approval at this time for both documents. Yes. No. So not hearing any, I'll accept the agenda that we're going to be working for this evening and the approval of the minutes of the November 10th, 2022 Board of Health meeting. I don't have a long chair report. I try to avoid delving into the world of pandemics, but we're now in what is being considered by many to be a triple header, if you will. There's a little bit of good news. At least nationwide, the RSV infections, which have been plaguing virtually every state, and certainly overwhelming our pediatric colleagues and the pediatric hospitals in Chicago, appears to be starting on a downward trend. And that's the good news. However, it's been more than replaced by what the experts consider one of the worst, if not the worst, flu season in recorded history, where these data have been maintained. I could show you a heat map, but I can tell you that Illinois and virtually almost all the southern states and most of the large population states is hovering around the highest threshold for influenza cases. The match with this year's vaccine isn't perfect. It rarely is, but it should be offering significant protection to those who are vaccinated. But that's the crux of the problem. We're still way behind where we should be vaccination-wise. Now, granted, this flu season is starting 3 to 4 weeks earlier than usually anticipated. And so it's our hope that the public, and especially the citizens of Skokie, will obtain the vaccine as quickly as possible, because as you all know, it takes about 2 weeks once you've been vaccinated to have adequate immunologic response. Now, you also have some issues with COVID. We're still talking about it, even though the House of Representatives didn't see fit to continue offering COVID vaccine as a requirement to the armed services today. But we're still faced with significant number of cases, and it's starting to rise. Now, the big issue is that the B5 variant of the Omicron variant, so the subvariant B5, has been significantly replaced, and it's only now about 25% of those isolates that are being tested. And the other problem is we're not testing adequate numbers of people anymore. So therefore, we feel this is woefully underreported. It has now pretty much been replaced as the predominant strain of the BQ1 and the BQ1.1. The good news is that the vaccine, the one that was recently offered starting in September, the bivalent vaccine, does impart some increased immunity. It's greatest in people up to the age of 50 years of age, and it starts to go down. But even people above 75, you will see at least a 25% increase in immunity from the prior vaccinations. Now, what we don't know is how well this match has been preventing severe disease. We do know in terms of the number of infections, again, significantly underreported, that it does appear to be giving an advantage. It's not a monumental advantage, but it definitely is an advantage. And since the immunity is tapering off, and those people that receive their vaccination with their booster, the largest population being around the spring, are now due for their bivalent booster. And again, we should be doing all we can to encourage that people become vaccinated, because we are seeing an uptick in cases. And California is having a particularly difficult time right now, but Illinois now has moved into the moderate to high zone for transmission. And Michael talked more about specifically the data with Skokie. A lot of what my conclusions are based is on wastewater analysis, and our wastewater is starting to light up with positive COVID, and it's moving towards a higher range we were a month ago. Mitigation strategies are critical. So as we move into the holiday season, we've seen the bump that occurred after Thanksgiving. This was anticipated, but as we move into the Christmas and New Year's holidays, with the weather getting even colder, more people indoors, crowded situations, mitigation strategies such as increased ventilation and using high quality, well-fitted masks, I'm going to suggest is still critical. And I know we want to keep this messaging going out to the community in Skokie in as many ways as possible. Similarly, hand washing is very important, especially now when you're dealing with influenza and RSV that I did mention. RSV does have a problem, not just in young children, but in older adults. So I think this is really kind of the biggest public health issue that we're dealing with acutely right now. And we're all hoping and praying that we don't see a winter like we did last year or the year before. Any questions about this or further comments? Yes, Dr. Werner.
Dr. Lynn, I'm hearing reports about shortages of things like Tamiflu and amoxicillin, and shortages of pediatric items like acetaminophen and ibuprofen that are used to treat pediatric flu. Do we have any idea if that's at the local community?
I'm not. We certainly talk about it, because it's being reported all across the country, and I have not heard from my colleagues that we're at a crisis yet, but it is of a concern. I know that amoxicillin, there has been shortages But unfortunately, there are other strategies besides amoxicillin. But the others that you mentioned, is of some concern. One more thing that I forgot to mention, because Bill, thanks for jogging my pharmacologic side of my brain. You all may be aware that because of these new subvariants, Evusheld, which was the major strategy of protecting immunocompromised people, is now been pulled from the market by Lilly. It has no impact against the BQ 1.1. And therefore, the EUA for it has gone away. I'm sorry, I misspoke. Bebtelovimab, that's the one that they pulled. Evusheld is also going to be deemed to be ineffective. It's still being used because there still are other strains around. And so but it's rapidly, many centers are stopping offering that. We don't have much in our pharmacologic armamentarium now. You mentioned Tamiflu for influenza. We have this problem with COVID. We still have Paxlovid for those people that are able to take it. Unfortunately, a lot of older people, there's relative contraindications to it because of the medications, life-sustaining medications that they're on. Remdesivir, which is awkward and certainly will be used in hospitalized patients, but since it requires multiple infusions over a short period of time, it's logistically a challenge. It's still available, and some and sundry other monoclonal antibody formulations that they have not been widely used before. We're hoping that the research in this area will bring some along, but at the moment we're feeling quite vulnerable from a pharmacologic perspective. Mike, I'm going to ask you a question. Have you heard any problems in terms of drug shortages in our community?
No, and I haven't, that's something where I haven't seen anything in any state siren message or anything. So I haven't heard anything. No.
Yeah, I think there's a lot of concern in California because, quite honestly, they've had a high incidence of cases, and I did hear an expert speculate that they may actually be reconsidering instituting mask mandates in California. But it's like the political third rail. People aren't particularly enthusiastic about anything that has the word mandate in it. So that's my report. I'm looking forward to the day we can talk about something else. But as I said, I just really felt this was important to bring you all up to date, and I didn't want to do a data dump, so I kept my PowerPoints locked up. So the next order of business, I'll turn things over to Mike Charlie. We have reserved residential parking, will program, mediation program, and lending closet program presentation.
Just give me 1 second to pull it up. And there, can you guys see it?
Yes, we do.
Okay. So originally, I don't know if anyone remembers, but I was actually going to have someone come in and talk about a different subject, but that individual couldn't make it tonight. So I kind of did a swap, and I thought I'd talk a little bit about reserved residential parking and the will program and the mediation program and the lending closet. So these are 4 programs that are housed in our human services division and have always been housed, well, not always, but are housed in our in our human services side of the health and human services department. And I thought I would just provide you guys with an overview of these 4 programs tonight. And certainly if anyone has any questions please feel free to let me know. So yeah, so let me first start off with our reserve residential parking for persons with disabilities program. So our village ordinance has a section on this program that outlines some of the provisions and some of the requirements. But essentially what this program is if you have a permanent disability, you can, and you're a Skokie resident living in Skokie, you can apply to get parking signs, handicap parking signs installed outside of your residence as closely to your residence as possible. To qualify for this program, you have to have a physician sign off saying you have a permanent disability. You have to be a Skokie resident. You can't have a parking space on your property that's available to the resident and or a garage. And typically what we do is if it's a two car garage or more, or even 1.5 car garage or more, then you wouldn't qualify. But if it's a 1 car garage, sometimes just because of the logistics will allow them to apply. What happens then is that application and a small fee gets brought to a committee that includes 2 members from Human Services or Health and Human Services, and then 2 people from engineering, and we review each application. And if approved, then a work order goes to Public Works to install the reserve residential parking signs. If you look at the picture to the right, there's no way anybody's going to see this, and I get it, it's too small, but right under the second sign in the distance, you'll see a smaller little tiny sign, and that little tiny sign will have the placard number of the person's disability placard for the state of Illinois. So what happens is only individuals that have that placard can park in that spot. What then happens is once annually on the anniversary date, those individuals have to renew their reserve residential parking through an application process. And we do deny people, and probably the number one reason for denial is that individuals have parking on their property. So we have to deny it. And that's an ordinance. You know, they have a parking pad in the back, or they have a 2 or 3 car garage, but the 2 or 3 car garage is filled with stuff and they just don't want to remove it. So with that said, if anybody, I might have a hard time actually seeing hands being held up. So if you have any questions, feel free to break in and interrupt me. I'm okay with that. But I'll move on to the next program area. So the will program.
Just one reminder to everyone, the electronic raise your hand function usually brings you into a frame that we could see. So it's another way of getting our attention. Thank you, Mike.
No problem. So let's talk about the will program. So we have an attorney, and we have had for a while in an attorney's office that provides for a reduced fee, living wills and simple wills. And you know, I'm certain most people on this Zoom know the difference between each one, but obviously a simple will is like sort of the last will and testament. It's basically who's going to inherit your assets and belongings after you pass away. And the living will is more about medical decisions. And what happens is the 3rd Thursday of every month, Skokie residents can contact Violet Amerkashi. She's one of our employees in the Health and Human Services Department, and schedule a meeting to have a consultation with an attorney. And they come in, and we have a room set up at Village Hall, and they meet with the attorney, and the attorney goes over, what they need to know for either the living or simple will. And the first visit is the consultation. And then what happens then is the attorney will use that information to draft something, and then they meet a second time. And after they meet the second time, then they pay the fees you see there, which if you do, I've done a little bit of research on it, and that is a pretty good price to have an attorney assist you with drafting a will. So it is at a discount to Skokie residents. And this is a service we offer for anybody interested in doing this. So If anybody has any interest in taking advantage of it, just let us know. So the mediation program. So any two neighboring property owners in Skokie who can't come to an agreement on their own, they have the option to get professional mediation for free. And typically what occurs is it's usually a lot of these things come into the police department or neighborhood services, or even some have originated in the Health and Human Services department. But when one neighbor and the other neighbor just cannot meet at their properties and have like a civil discussion, usually one of the two neighbors will contact us and want mediation. But what happens then is we send a letter to both parties, and both parties have to agree to meet. And if both parties do agree to meet, then we set that or coordinate the mediation through the Chicago Center for Conflict Resolution. So this is a service we offer to residents. We don't have a lot of them. It doesn't happen that very often. And what I've been told is most of the time when we send the letter out, one of the two will call up and say, look, I don't need mediation. I'll just go talk to my neighbor. So it does end up working out typically where they talk, but just like anywhere else, Skokie does have neighbors that just don't get along or don't agree on things. And then the last program I was going to talk about is our lending closet. So these two pictures I took yesterday. On the left is, or up on top, which would be to the left of our closet area, are some of the wheelchairs we have in stock. And on the right are all the walkers and crutches and canes we have in stock. Actually, to the upper picture is the canes. But essentially, anybody who's a Skokie resident can come to Health and Human Services in the basement of, or in the lower level of Village Hall, fill out a small form and reserve walkers, regular walkers, walkers with seats, canes, crutches, and wheelchairs. For the walkers, regular canes and crutches, I think it's 6 months. I think it's, if you come and pick them up, you keep them, because we have so many of them. As you can see on the picture on the bottom, that's a stack of walkers on the second shelf there. And then for the wheelchairs, we have some more heavy duty wheelchairs. Those have to be returned. I think it's in 30 days. And the lighter duty wheelchairs, I think it's a little longer. And then the walkers with seats, we just don't have as many of those, although we do have a lot in stock right now because we just had like a donation drive. Anytime we run short on supplies, we just put something in the Skokie e-news, and we tend to get a pretty good response from residents. They bring all sorts of stuff to us. So everything you see there has been donated from usually Skokie residents. So it's a cool program. And those are the 4 programs and the quick version. Does anybody have any questions on any of those or any comments? If not, I think I'll move on to my updates section, if it's okay, Dr. Lynn.
That's fine. It dawned on me, and I just want to remind folks that with the agenda minute packet outline of this particular presentation, Mike also sent out an organizational chart. This was something that was suggested by Sybil Yao, and I'm indebted to her to be on top of this. And I just want to remind you that a lot of the names that Mike mentioned and a lot of the services are now outlined for you to understand the complexity of the Health and Human Services and the various activities. So that's all, Mike. You can go on with your report.
Okay. So the first thing I wanted to mention, and I'm not sure if Dr. Lynn, you were going to mention this, or Sybil, if you were going to mention this, but Michael Vernon has resigned from the Board of Health. He just felt this was the right time for him to move on, and he had just submitted his letter of resignation within the last couple of days. And I actually spoke to Mike this morning for about 25-30 minutes just to get feedback on what he thought about the Board of Health and other things. And he told me that he was sitting on on a balcony in Belize and it was 75 and sunny. And I think it just set the tone for the whole meeting. So, but he's doing great, and he wanted to thank everyone and said he'll miss everybody on the Board of Health. So, and I'm sure, and I thanked him profusely for everything he's done. And I've known Mike for a long time because Mike worked for the Illinois Department of Public Health, and my past life, I've worked with Mike on different things, and he's assisted me with different things with like syndromic surveillance and data, and that's sort of his passion. So I really appreciated him helping me out professionally through the years outside of this Board of Health. So I've historically started with COVID-19 updates. I'm going to keep it kind of short. Our community level for Cook County is medium. Our transmission rate has gone up recently. We actually saw a small spike since Thanksgiving. I think that I've seen on the media where the CDC director and others have said it's alarming. And I don't know. I'm not an expert, but I would think that because of the Thanksgiving holiday, you're certainly going to see a spike with any disease directly after the holidays. But we'll see what happens if that curve continues to increase with COVID, or we sort of level off. But we have increased slightly recently with our number of COVID cases here in Skokie. And I do have a chart, 3 slides from now for the state of Illinois. It's almost like identical, this little spike that's occurring. I did want to communicate that iCare data, which is iCare is where we store our vaccination data. We have about 25% of Skokie's population now has received the bivalent booster. That's up since our last meeting, which is good news. I think the last meeting we were on 15%. I think Dr. Lynn has gone over it, but it's just a good idea people get their bivalent booster. I will say since the last meeting I had COVID. So I think the Saturday or Sunday after our last meeting, I'd gotten COVID. But I feel great now, but it took me about 3 weeks to get over it. So my family had gotten it, everybody but my daughter ended up getting it, but I think my son or one of my sons or my wife ended up giving it to me. So, but I am feeling great now. So which is the good news. So some vaccine updates. Nothing really has changed much. Actually, I didn't update this slide with the number of cases, but we still continue to administer the booster doses, the Moderna doses. I will say the one concern I have with the vaccines is if the federal government goes to the not paying for vaccines and they end up we end up going to a more model where it's $133 for a COVID vaccine, then the village of Skokie may or may not get out of the vaccine business with COVID vaccines and or just continue with smaller clinics and push people towards regular providers. We do have the ability to bill private insurance and Medicare, in which we can do. But it gets a lot more complicated when we have to go through all the billing with each individual and collect their insurance. I'm hoping that, or actually, I believe COVID vaccines have already been added to the Vaccines for Children's program. So I'm anticipating that we'll continue to get free vaccine from the state with that program, so we can vaccine those that are underinsured or uninsured and meet certain income requirements. This is a chart. I know it's small, but if you look right here at sort of around Thanksgiving, we saw a small spike. I know it's really, really small and I apologize. But it's sort of, this is the community transmission rate. So obviously, I always tell people this that are sort of, especially at like staff meetings. I was just at a staff meeting with like police and fire and police and finance, and they don't really get this stuff as much as I do, but people think that just because the CDC has eliminated the requirement for masks and opened everything up, that everything's fine. But really, we know as public health professionals that it's not. I mean, we're still at a high transmission rate. It's just that we have the monoclonal antibodies, the antivirals, the vaccines, the hospitals understand how to treat patients better. So even though the transmission's high and people are getting it, we just aren't seeing as many people dying and being hospitalized as we were at the beginning of the pandemic.
Can I interrupt for a second?
Yep.
Not to belabor the point, but we're now seeing more admissions locally, throughout the metropolitan and the county of adults being hospitalized. People kind of weren't maybe not aware of the fact that an average nationally, half of the hospital admissions were in children. And for that reason, you may have heard the news that the first step in the approval of the bivalent booster occurred yesterday with the FDA committee recommending that both mRNA bivalent booster formulations be approved down to 6 months of age.
Mhm.
And I know the pediatric community was waiting for this. There's one more step, and that's the CDC advisory committee approval, but that usually does occur, and that's hopefully will be by next week.
Mhm.
So that will expand those children to be vaccinated. But just again, to go back to your point, yes, the good news was we're up in terms of the Village of Skokie booster vaccinations from 15 to 25%, but that's still really alarmingly low. Remember, these are people that were up to date with their vaccines, who are now eligible for the booster, are not getting it. And that is the thing that has everyone concerned, because with the diminution of the available treatments, if someone doesn't have the added protection immunologically, they stand a much greater chance of getting significantly ill, and we may not have much to offer them. And so that's the big concern amongst the the people in the field. Sorry to interrupt. I just wanted to talk a little bit about that, the approval of the boosters.
Not a problem. Thanks, Dr. Lynn. So this is just the state of Illinois chart. And the only reason I threw it on there is throughout the pandemic, the state chart has literally looked like the Village of Skokie chart. So if you look just recently, that small little blip since Thanksgiving, and that's sort of similar to what we're seeing in Skokie. So some other updates. So I have two things that I wanted to talk about in regards to larger village plans. And in the context of these plans, I think these are both areas where we can use Board of Health members. The first one is the I-Plan process. So on November 18th, from what I understand, there were 60 plus or 60 plus individuals that met at the library. And the purpose of that meeting was to identify 3 public health priorities to focus on over the next 5 years. And unfortunately, I had COVID, so I couldn't be there, although I wanted to be there. But the following 3 priorities were identified: affordable housing, access to care, and mental, behavioral health. So what does this mean? So the next steps in the process between now and March is to set up some 3 smaller subcommittees, subgroups, to take a look at these priorities and come up with some objectives, hopefully measurable, and some strategies to meet those objectives over the next 5 years. And what that would look like is meeting with same-minded, or not, that's bad. Meeting with qualified individuals or people who have some expertise in these areas, and or people who just want to provide their input to come up with these objective strategies, and also identify stakeholders and resources. And I talked to Liz Nelson via email today because she's actually on vacation in Florida. So thanks, Liz, for responding to email. But I think this, when I talked to her, she asked me if I could mention tonight and invite one or two of our Board of Health members to help chair or lead or facilitate the access to healthcare subcommittee meetings. In addition, I wanted to throw it out there to this group, and I will also send a follow-up email, myself or Liz, inviting Board of Health members to participate in the affordable housing, access to care, or mental behavioral health subgroups, which would mean, I don't know what the time commitment is because Liz was out of the office today and I emailed her that question and she didn't respond by tonight. But I think this is a great opportunity for Board of Health members to participate outside this meeting. And then if applicable, as we work through the I-plan process and finalize it around June of 2023, be able to bring things back to the Board of Health and have some discussion, and even include the Board of Health possibly in the strategic process as one of the stakeholders involved with one of the strategies, whether it be research or whatever else is involved with it. So what I can do is I will send an email out to the group, to the Board of Health, introducing this and asking for volunteers. If you're interested, just let myself and I'll have Liz on the email, so you can email Liz and I and just let us know. Does anybody have any questions about the I-plan process?
Mike, I have more of a comment than a question. When you send out that letter, especially for the people that aren't present tonight, who are on the mailing list, if an explanation a little bit about what you just told us, so a little reiteration of how you envision this role, and if you've learned from Liz what she thinks the time commitment would be, may help people understand whether or not this is appropriate for them.
Absolutely. Okay. And the second major plan I want to introduce, and I know Sybil was on some of these committees, so thank you, Sybil, but the sustainability plan is I think it's an 8-year plan, but they finalized the sustainability plan, and we're currently in the process of, we have a plan, and within the plan there's a matrix of different objectives and goals. And where we're at right now is we have some internal stakeholders, being people within the village, who are currently reviewing this matrix, which includes identifying external stakeholders that can assist us with achieving some of these actions and goals that are identified in the plan. So this is another great opportunity for those individuals on the Board of Health that have an interest in sustainability and working on these groups to potentially provide their expertise and input. What I will do, or what I'm going to do is two things. I'm on 2 of the groups internally out of like the 8 different groups. And I can share the sustainability plan with the Board of Health in detail and the matrices. I can advocate to the internal stakeholders that are identifying resources to consider the Board of Health as a group of professionals that could potentially help move some of the actions and goals forward. And I'm also going to recommend they consider how we as a group maybe can do research or provide input or provide recommendations. So if there are things that can come even back into the Board of Health meeting for discussion that would help achieve some of these goals, I'm going to recommend they consider that as they go through the internal part of that. So again, I will follow up with an email on this, asking individuals if they have any interest to let me know. But what I did want to say is, and Sybil, I don't know if I want to give you an opportunity because you were really more involved with the sustainability process than I was up until this point. If you have any comments or you have any recommendations or suggestions.
Yeah, thank you. I think the sustainability plan's on the website, and the section on for human for health is on there. So I think in advance people could go to the website and check it out for themselves. But there are lots of opportunities to do some work on this once the external stakeholders have been opened up. Because as far as I know, they were working on just the people that work for the village. Is that right, Mike?
You are correct. You are correct. At this point, it's sort of an in-house thing, and then that's when we bring in external stakeholders next.
Right, and the Board of Health would be considered external, I think,
Yeah.
right?
Yes.
Okay. So, but yeah, there's a lot of education and things regarding, excessive heat, lack of power. So those things will all impact our Skokie residents. And the health department the Board of Health would be helpful. And then there's a lot of food initiatives that would also overlap into what we work on. So I think there's plenty of work that people could do if they could think about how much time they would be able to devote to an activity. It might be helpful to just start thinking about that process now.
Thanks, Sybil.
Mhm.
Does anybody have any questions on the sustainability plan or the I-plan? Okay. So I think the last item I was just going to mention is that we're currently in the midst of our Assist a Family program, where we have 326 households. You can see we have 591 adults and 625 children that have successfully applied for the program. And I believe we changed it now, but it was going to be this Saturday, but we have to change it. A week from Saturday, we're going to distribute gift cards. I think it's going to be a $30 gift card per individual to these families as part of this program. And the gift cards will be from either Target or Jewel. And it's something we do annually, and it's funded 100% from the donations of primarily Skokie residents to the Assist a Family program. And so it's a great program. Individuals that qualify for it, most of them are within 165% of the federal poverty level, which is the same percentage that they use for like the supplemental nutrition, the food stamp program, people used to call it, supplementation assistance program through like the state of Illinois. So these are people that qualify for assistance. And then there are also other people that we've worked with over the last year who we know who have applied for emergency financial assistance that we sort of just automatically put into the group. So it's a great program. It's really a good feel-good program, and helps out a lot of people during the holidays. And I think that's it for me.
I just want to again urge everyone to make a donation to this program if possible. Mike, I know in the Skokie, excuse me, the Skokie Electronic News, they did put the address. And I don't know what you prefer, and if you can just send an email to everyone as the best way of getting a check to you.
Just go to our website, and it's right on the front page. It's Assist a Family. The best way is just to donate online. That's the easiest way.
Yes, the easiest. Well, that's great. I wasn't even aware you can donate online, because I know I was very reluctant to mail anything. I wanted to hand deliver it.
Yeah. People can visit our website and find it. I think it's on the front page. So
Very good. So thank you for your presentation. The next order of business, we're in the old and / new business. We've already announced Dr. Vernon's decision to retire from the Board of Health and enjoy his retreat in Belize. I think we should organize a field trip to check it out. So the next is a discussion about the onboarding subcommittee activities and
Oh yeah. I have one more thing. I forgot to mention.
okay.
Sorry about that. Sorry about that, guys. This is very short. So I'm also going to send an email out, a lot of emails, offering Board of Health members an opportunity to come and visit the health department and get a tour. So I don't know if I'm going to do this on a sort of, I'm going to pick 2 or 3 dates or, but really any one of you, if you ever want to visit, just call me and I'm more than happy to walk through for 15, 20 minutes with you. Not a problem. So I can cater to you guys too, if you want to meet later or earlier, whatever. So, but that's it.
Thank you. All right, so I'm not sure who's going to take the lead on this. Heidi, are you going to for the subcommittee on the onboarding?
Sorry about that. Did you just call on me?
Well, I'm asking if you were the one.
Oh,
I don't have an identified person. I just have the
The
topic.
the onboarding, and I'm sorry, I was switching devices right at the absolutely wrong time. I have a request to push that item, the onboarding report to January. If we are okay with that, I kind of pre-cleared that with Sybil, but okay, if that works, great. And then I had a quick question though that might add something to that onboarding report. When somebody leaves the board, do we send them a thank you? Or do they get a thank you?
I get a thank you from the mayor's office.
From the mayor's office. Okay, good. We'll add that. Thank
And
you.
again, it's actually the letter was actually directed to the mayor.
No,
I'm not saying the resignation letter. It's the same thing as the appointment. It really kind of starts and stops, in his office. But I agree with you that whatever we can do to recognize people's activities, and Mike, I don't know what the past customs were. I think even a nice frameable certificate may be the minimum that the village. I don't know what they do for.
We actually send out an invoice.
Oh,
No,
super.
Now, as far as I know, the mayor's office sends a thank you letter. I had a conversation with Mike for I thanked him about 10 times this morning, and just to kind of get his feedback and things like that. But I do know the mayor's office sends out a thank you letter. I don't know if it's a certificate or what. I can check and let you guys know.
Okay, that would be great, because something personalized, like either a certificate or a letter acknowledging, like there are particular things that we relied on him for specifically, for instance, that might be nice to recognize. But anyway, if you can verify that the mayor's office sends something out, at least that will get in the documentation.
Just a friendly suggestion coming from us, not a formal resolution, because I don't know how they will accept that, but
No, I'm just wondering, do
No,
they
I
or
was
don't
talking-
they?
I'm kind of reiterating what you're saying. I
Yeah.
think there has to be some, expression of gratitude, especially for.
I'm 100% sure they send a letter out. I'm 150%
That I
sure
know.
they send a letter. I just don't know
Okay.
if it's
That I know.
Perfect.
it's also a
I
gift
wasn't
basket
sure
or
if they do anything more to talk about, the years of
yeah.
activity when someone's been on the board for many, many years.
Thank you all, and we'll have a better report for you in January.
Okay, so we have a little opening in the schedule. I don't know if Sybil, if you have anything else you want to add from your activities, which have been many since the last meeting.
Well, the thing that I wanted to mention was we've been discussing with Mike and Dr. Lynn the idea of having an introduction given by the board members to our group because some of us joined during the COVID time and we don't really know each other very well. So we'd like to have 3 people per month kind of give like a 2 to 3 minute introduction of themselves and why they joined the board and what they're interested in doing. So I guess it would be great to have this go out in an email. And I don't know if there's among the people that are on tonight, if there's volunteers who want to be the 3 people in January. But I think that it would be a great segue to getting to know each other better if we could do that. Anybody have any ideas or questions or something they want to say?
That's a good suggestion, Ms. Yao. In the past, what we have done alphabetically, person whose name come up, they will speak at the meeting and give their personal information and why they wanted to be a board member or how long they've been a board member. So yeah, now with the 3 members.
You went on mute.
Yeah, you muted yourself. Well, I'm going to continue on with
Okay.
that. So I think we know when the next meeting is. And I think maybe for this particular time, the idea of alphabetically is fine, but we don't get everyone attending. So, and January may be still in the midst of the winter break vacation season for people. So are there any members tonight who know they're going to be able to participate in next month's meeting who want to kick this off? And I'll volunteer myself. And we're looking for 2 more people, and we're trying to. We know that people filled out a form, and for many of the hosts, it could have been years ago, with your background, and things have obviously changed over time for many people. And so it's just like talking a little bit about who you are and what your interests are and why this brought you to the Board of Health. So you can put me down as a kickoff.
Okay. I could do it as well.
I don't see the hands flying.
Nah.
I can do it as well, since Dr. Lynn and I joined at the same time.
Well, and Sybil right around the same time too.
Right. Yeah.
So
Great.
And it actually makes sense because maybe the newer people are less well known to the veterans, if you will. All right.
Thank you, Margaret.
I appreciate it. Mike, are there any public comments?
Give me just 1 second. I did check before the meeting and I did not see any public comments, but we will double check.
Hello, this is Dr. Gaines. Hello, everybody. I just wanted to say hello to Dr. Werner, and it's so good to see you. So
Thank you, Dr. Daines. It's good to be here.
yeah. Good to see you. Good to see you.
Thank
No
you.
public comment, folks. No public comment. None.
Okay. I'll solicit one more time. Any other comments, concerns that the board members want to bring forward? So not hearing any or seeing any, I will then entertain a motion for adjournment. So moved by Sybil. Is there a second? Dr. Werner seconds it. And so therefore, I will let you vote by clicking off.
See you guys. Thanks.
Bye.
all.
Everyone be well and have a happy holiday season and a healthy one.